a meta-analysis of 8 randomized control trials involving around 750 people with knee osteoarthritis. So we have degeneration of that cartilage of the meniscus that sits between your femur and your tibia at the knee joint. So it's getting thinner over time, and what happens is the bone approximates. This could be stiff, this could be achy for people, reduced range of motion. What can we do for it? We'll talk about that in a second, as we have before here at When Wellness. But in this trial, they examined the effects of yoga on knee function and knee pain. And yoga actually showed a significant improvement when done a few times a week, anywhere from 1 to 7 times a week. So many of the participants just did it a few days, and it still provided some benefit for about 1 to 3 months, okay? And it reduced joint stiffness to a moderate degree. It improved physical function to a moderate degree, but to a very significant degree, it reduced joint pain. So look at that. Movement is medicine. You know, we see that common mantra come to fruition yet again here at When Wellness, and it is really one of the truest things when it comes to reducing your risk for chronic disease in general and helping to heal your body. So what else is good for osteoarthritis if you're somebody that has OA or you know someone that has osteoarthritis? Well, movement, of course, low impact aerobic exercise. Resistance training is good. Yoga, Tai Chi, Pilates, aquatic exercises, riding a bike, maybe a stationary bike, all sorts of things of that nature. And we would love to lose some weight if we have OA, because if we can lose some weight, then we're going to put less pressure on the joints, all right? Especially when we're talking about something like the hips or the knees, which are super common, right? So what kind of supplements do we have for osteoarthritis? Well, the classical recommendation as of the last few years, according to Examine, the best source for natural supplementation for all sorts of diseases and this and that, that's unbiased, would have 3 top options. And those would be undenatured type 2 collagen at 40 milligrams a day, curcumin at 500 milligrams 3 times per day, so 1.5 grams a day. And you would want that standardized for 95% curcuminoids. Now, those are the bioactive compounds responsible for reducing the inflammation, reducing joint stiffness, improving joint mobility and functionality, potentially pain in people with osteoarthritis. But remember, losing weight and movement are the key, above all supplements, and having a healthy diet, of course, right? Which will also help you to lose weight. So it's a great thing, and reduce the inflammation. Okay, so aside from curcumin, by the way, you have patented forms of curcumin. If you want to go for BCM 95 or Mariva, you only need 500 milligrams twice a day instead of 3 times a day. They are standardized for curcuminoids, and they are combined with a fat that improves the absorption of the curcumin. Otherwise, if you're going to get curcumin in isolation, you can get it with something called piperine. About 20 milligrams should do the trick with that 500 milligram dosage for the purpose of improving the absorption and bioavailability, meaning the amount that our body can take up and actually utilize of curcumin. Okay, so we have those 2, and of course we have omega-3s. 3 grams of combined EPA and DHA per day. Maybe fish oil isn't the best option, as we've spoken about on When Wellness previously, because a lot of those fish oils are rancid. They get oxidized easily and damaged. Those healthy fats get damaged. And, you know, anywhere from 45 to like 90% of them could actually be rancid on the shelves, right? So maybe we want to stay away from that and go over something like krill oil or algal oil. But regardless, you want to make sure that you're going to get that 3 grams of combined EPA and DHA in a day. This video is not intended to treat, diagnose, cure, prevent any disease, right? Disclaimer. So we have those 3. Now, they've actually added Boswellia serrata. It used to be a secondary, tertiary option. Now it's a primary option as well, alongside those 3. And so Boswellia serrata contains boswellic acid, which can help to reduce joint inflammation and joint stiffness and improve joint function and mobility in people with osteoarthritis. And many studies are done in people with knee osteoarthritis, as we're talking about today, in reference to the benefits of yoga, right? So Boswellia serrata, you could take Aflapin or 5-loxin. Those are 2 patented forms of Boswellia serrata that are standardized for boswellic acid and highly bioavailable, meaning absorbable, yet again, that our body can use. And you can have just 100 to 250 milligrams of those in a day, okay? Now, everything we mentioned so far, you want to take with food. And we'll tell you what you're going to take that's not with food, okay? Pretty much most of them are with food, spoiler alert. So if you're going to take the gum oleoresin of Boswellia serrata, a non-patented form, 1,800 milligrams 3 times a day is the common recommended dosage. Now, you could have that with something else that improves absorption. Of course, make sure it's standardized for boswellic acid. That's the bioactive ingredient, as curcuminoids are in curcumin, for improving joint mobility, reducing joint stiffness, and potentially joint pain in people with osteoarthritis. We have black cumin as a secondary option. Now, if the previously mentioned four don't quite do it for you, after say 2 weeks or so, we can go for some black cumin or black seed oil, good for other things as well, and that would be 7.5 milliliters a day. Okay, that also would be taken with food. So then we have something called pine bark extract or pycnogenol as another option if those all don't do it for you after a few more weeks, and you could add that in. Now, especially if you have high blood sugar, this may be a good option. It's shown to improve blood sugar control, right? Insulin sensitivity, how we regulate blood sugar in the body. And so that's a good thing. Now, aside from that, it does improve joint pain and joint stiffness, joint mobility. Sometimes, you know, not completely consistently in trials, but it is a secondary option when it comes to improving the aforementioned things in people with knee osteoarthritis or osteoarthritis in general. All right. We also have methylsulfonylmethane, that's MSM, and we would take that at 1,125 milligrams 3 times per day. By the way, when you are going to get the pycnogenol, you're going to make sure that it's standardized to 65 to 75% of the bioactive compounds. Okay, so make sure of that. We want standardized things, always remember, because they're what do the trick, right? It'd be like the same analogy of having, you know, coffee with no caffeine or beer with no alcohol, right? If you're looking to get messed up, right? And that wouldn't make any sense. We don't recommend beer or alcohol here at When Wellness because it's not good for you. But we have that. And then finally, we have glucosamine, and chondroitin sulfate. Glucosamine and chondroitin sulfate more so do the justice or help the joint, we could say, improve the integrity of the joint, and help to maintain the thickness of the cartilage, we could say, before you get osteoarthritis. So they're not really going to help with the pain and the stiffness and all those sorts of things. But if you're looking for something to take in a prophylactic or preventative sense, then glucosamine and chondroitin would be good. 600 to 1,200 milligrams of chondroitin sulfate in a day, and it would be 1.5 grams of glucosamine, right? Crystalline glucosamine sulfate. So those are all really the top things. Now, another thing to keep in mind is vitamin K, right? Now, interestingly, some of the proteins that are involved in reducing calcification rates of the cartilage, so that cartilage hardening over time, becoming more bony, right? Maintaining that thick cartilage, they require vitamin K to go through their reactions and to do so, right? So that would be something that we would like to take as well, or get from food, primarily, of course, first and foremost, all right? What types of foods have vitamin K? Well, when we talk about vitamin K2, that's the animal forms. So we find that a lot in meat and seafood and all that kind of stuff. Now, when it comes to K1, that would be phylloquinone. That's more involved in blood clotting. We would find that in leafy greens, right? Things of that nature. So that's what we got for you guys today. I hope, you know, that was useful. I hope it was quick and effective to the purpose of telling you things that are good for osteoarthritis, namely knee osteoarthritis, which is very widely studied throughout the world in terms of natural supplementation and lifestyle changes that can improve it. Who do we got on here? Liv, what's up, baby? How you doing, pretty girl? Veggies. OG. Dave 07, Ezekiel. Batista, no filter. Soy. We were on a 37 is not an elderly man. I never said that. Wouldn't say that. C9. Sam Tanny. Dun Spice, and you're as young as you keep yourself, right? Age is just a number, you know. Kevin, what's up? Sabia, what's up, girl? Happy Sunday, and Wallace. As for now, you guys. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing rest of your day. Happy Sunday. Happy When Wellness. See you later.